Formed under the direction of the provincial government in 2019, the Niagara Ontario Health Team are still in the early stages of creating an inclusive and efficient healthcare system for the region. With the long-term goal in mind, they recently held information sessions across Niagara to explain who they are and get more people involved in the process.
We've been doing lots of work behind the scenes, many of us, all of us volunteering. And so I think this is the point at which we need to sort of go out into the community, explain what we're trying to do, who we are, and how people can have a chance in participating in the planning and the decision-making of the future of healthcare in Niagara.
Several sessions in, how have they gone?
I would say it's gone well. I think it's a completely different idea, a different tone, a different philosophy. I think people traditionally have not necessarily been involved from the grassroots up in terms of how to impact and influence decision-making in healthcare service delivery. And so this is a completely different notion. How would you like to get involved? Come and help us make the decisions, share your stories, tell us what's important, and we can use that information to make it better for everybody.
Is it a bit of a process to build the trust that's needed to accomplish what you just said?
I would say absolutely yes. I have lived and worked in Niagara for 40 years, and it's hard because we all have our own little territories, whether they're geographic or whether it's around service areas. And so, yeah, it is hard to build trust, but I think we've spent 2 years building that amongst the partners, and now we need to build trust with the community. Well, the answer is we're a growing network, I think that's the phrase we're using, of 45 different organizations in the community, not just healthcare, so some social service providers, education, a really cross-sectoral group of organizations working towards making healthcare better, and it takes time to build those relationships, and I would say we've spent the last 2 years dedicating quite a bit of time to that.
As you see things moving forward, what are the logical next steps for the team?
Well, the logical next steps are to involve the community, which is, as I already said, part of this whole process, and then establish some plans in terms of where we need to head and identify perhaps some areas that need particular attention and focus, and all that within the parameters established by the Ministry of Health, of course. They are the funder for the OHT.
There are similar health teams across the province. How closely do you pay attention to their work, or do you try and not pay attention to it and stay focused with Niagara issues and Niagara solutions?
Well, I think it's important to strike a bit of a balance there. I think it would be sort of silly of us to ignore what some of the other OHTs are doing in the context of saving ourselves some time and energy and effort. If there's a good idea, why not possibly duplicate that? But at the same time, the emphasis is on a local flavor, that the OHT will meet the local needs of the community here, the 370 some plus attributed, 70,000 some plus attributed population that we will be serving who have very specific and potentially different needs. So I think finding that balance is important.
Stewart-Kirkby is hopeful the public will seize the opportunity to get involved in the process and recommends residents double-click the Get Involved tab on the team's website. In Niagara, you're watching The Source on your TV.